Good evening, everybody. Thank you so much for joining me tonight on YouTube Live. Hope you all are having a very nice summer. I'm Dr. Howard Elkin, the medical advocate, and tonight we're going to focus on the heart brain connection or the link. And you might be saying to yourselves, why would a cardiologist be talking about the brain and the nervous system? And there's a good reason why, because the heart and the circulatory system pump oxygen rich blood to the brain. The brain, and then in turn, go ahead and can regulate heart rate and blood pressure. So it's a very important connection, and it's vital to our to our well-being. Now, thinking this not pretty, this sounds pretty outlandish to you. Consider the fact that the brain, which probably weighs about 2% of our body weight, utilizes about 15 to 20% of the cardiac output. So it's disproportionately small in relation to the amount of output that it requires from the heart. So it's a very important link and connection. So really what my talk is about, our presentation about, is how do we calm the nervous heart? And it's really about balancing the autonomic nervous system, which we're going to talk about. But first, a little bit of review, the basic anatomy. So you have the central nervous system, which is the brain and the spinal cord, and then you have all the nerves that branch out from that. And that's called the peripheral nervous system. So that takes care of all of our conscious functions, like bicep curl, or to extend my shoulder, I want to tilt to the right, turn to the left. Those are all conscious moves that I make, and that requires the central nervous system. But the autonomic nervous system is a little bit different, and that refers to the coordination of involuntary processes, so digestion, breathing, heart rate, and other such functions. So I think of the autonomic nervous system as regulating involuntary physiologic processes. And there's three distinct parts. One is the sympathetic nervous system, which you all heard about, fight or flight, right? And most of us, unfortunately, in this day and age, because of all that we see, or what we see around us, experience around us, are in that constant fight or flight mode. Okay. And and it's useful if you're getting chased by a saber-toothed hiker or something like that. But most of us aren't in that situation too terribly often. So we probably use this a lot more than we really need to or really want to. Then they have the autonomic nervous system, which is regulated by the hypothalamus, which is the part of the brain, the hypothalamus that regulates the autonomic nervous system, which again is responsible for involuntary responses. Then you have something called the enteric nervous system, which is a part of the autonomic nervous system, and it actually regulates bowel function and a lot of the things that gut does. And we'll be talking about that at another time. We're going to leave that out for the time being. So really, I think of the autonomic nervous system as a relay between the central nervous system and the internal organs. And that's really what it is in a nutshell. So some of the things that that you need to consider, the functions of the autonomic nervous system, are blood pressure, heart rate, body temperature, digestion, metabolism, urination, defecation, sexual arousal. These are all processes that really depend on the autonomic nervous system. Now, there's two branches that you're aware of, sympathetic and parasympathetic. Sympathetic is that fight or flight that I'm talking about, which is, again, very useful in certain stressful situations. And exercise, for example. When you exercise, we have to increase our cardiac output 3 to 4-fold just to be able to perform exercise and to be able to pump oxygen-rich blood to the muscles. That's sympathetic nervous system. But parasympathetic, think of it as conserves and restores. Doesn't that sound calming? Conserves and restores. It slows the heart rate. It lowers the blood pressure. It allows you to digest your food. It's very calming. And that's really what we need to do. We need to create that balance because we really have those two systems, and they need to be working together versus to be disparate. Now, I already mentioned that the sympathetic system increases heart rate and blood pressure. Again, essential during emergency situations, stressful situations, and exercise. And the autonomic is the opposite. Now, one thing you need to know is that we know from scientific data that resting heart rate really does have a role in mortality, because resting heart rate, the lower the heart rate, the actual more input you have from the autonomic nervous system, specifically the parasympathetic nervous system, and the better, the lower the mortality. So there is something special about having a lower resting heart rate. That has to do with, again, the parasympathetic nervous system and mortality. So there is something special about that. Now, the body is really amazing because I don't care if you believe in evolution or what, whoever creates the body, but the heart, there's two systems that can often work together. So you've got the autonomic nervous system controlling the brain controlling the heart, but the heart also has its own pacemaker. The heart really doesn't even need the impulses from the brain because it can pump the blood. I don't know how long, but it can pump the blood. The problem is that when you just have the heart working on its own without input from the brain and the nervous system, you often have a faster heart rate than expected. So we really are it's very fortunate that we have both our own internal pacemakers in the heart itself and also the input from the brain. Okay, so I always like to mention about heart failure because heart failure, congestive heart failure, is like autonomic nervous system going amok. I mean, it's like total chaotic. And I mention it because it's so important. The most common cause of hospitalization in those over the age of 70, and definitely age 75 and up, is congestive heart failure. So it's very common. And what you need to know is that the mortality rate is really high, despite all the advancements in pharmacologic new drugs and things like that. But the mortality after hospitalization is like 10% in 30 days. It's 22% in 1 year, and it's 42% in 5 years. So although we have great pharmacologic agents these days, it still carries a high mortality rate. It's unacceptably high, and it's really characterized, like I said, it's essentially the autonomic nervous system going amok because you have increased sympathetic response and basically a withdrawal of parasympathetic. So it's imbalance times 100, tenfold, right? It's amazing. So when we talk about heart failure, like when I was a student and an intern, we would never give someone beta blockers, which actually have we think, oh my God, that's the worst thing to do in heart failure. Now we know that heart failure is, again, neural, hormonal, out of control, highly sympathetic increase in tone. So with our medication and so forth today, we try to calm things down. Everything's about calming the nervous system down so that the heart has less stress to work. Now, so what I want to talk about in the last few minutes is how do we balance ourselves? I mean, one thing is to talk about the autonomic nervous system and balancing sympathetic with parasympathetic, but how do we actually do it? And that's what I want to focus on now. So if you are able to see my last video, and I hope you do, because we really talked about stress at a more general, I call this de-stressing part 2. We're really focusing on the nervous system here. But box breathing has been around forever. And my breathing that I talked about in the last session is a little different, but box breathing is easy to talk about. So basically it's 4, 4, and 4. So you breathe in for 4. You count yourself 1, 2, 3, 4. You hold for 4 seconds. You let it out for 4 seconds. So again, I'm going to demo. So it's 4, 4, 4. I do it a little bit different. If you remember me from last 2 weeks ago, I breathe in through my nose on a count of 4. I hold for 2, and then I exhale on the count of 6 or 8. And I use a hissing sound. I put my teeth together because I like that calming sound. But box breathing is very easy to teach, and most people know about it. So it's really it's a very easy technique to use. So what else do we do? Going for a walk, especially after meals, good. Also helps to lower your blood pressure. Taking, I'm a cold water person, but if you are tense at night, a great way to relax and calm down is to take like a warm bath with Epsom salt. That's a great way to do it. And also relaxation exercises. Yoga is great. I don't do yoga, but I do Tai Chi. I'm doing learning Tai Chi now. And I like it because it's like meditation in motion, but it's very slow motion, very calming, and I enjoy it. And the other thing is to change your thinking process. Now, I'm just learning this now. So I'm a double Leo, and I tend to react. I also think I'm Jewish, so it's probably genetic, right? That I overreact. So now, and I've really been working on this lately, and I want to share it with you because I think it's so important because I have to deal with stress all the time in my work and in my lifestyle. So now when I have a thought, I don't have to act on the thought anymore. Before I would just react. But now I have a new saying. Shelve it. Shelve it. That's right. So a thought comes over me. And I said, do I really need to think about this now? Do I need to even worry about? Do I need to confront this person? The answer is usually no. So I said, let's shelf it. Let's shelf it. And maybe we'll come back to it later, and maybe we won't. And I've just started to do that recently. And I'm noticing my triggers now. It makes me more aware of what triggers me. So I do recommend that you do the same for yourself. Then we have vagal nerve maneuvers. Vagus nerve is your 10th cranial nerve. It's the longest nerve. It starts at the base of the brain, goes to the neck, through the thorax, and into the abdomen, the trunk, and helps to innervate the viscera. So it's a very long nerve. And a lot of things you can do to stimulate the vagus nerve. One is to hold the breath and bear down like you're having a bowel movement. And we do this sometimes when people are having arrhythmias. I can usually stop the arrhythmia with that. Cold water, splash cold water in your face, put a cold towel on your forehead. Chanting, the kind of thing they do in yoga. So chanting, I sing. Singing is a great way to try to get your parasympathetic nervous system going. And then there's some exercises that I like to do for a vagal tone to kind of reset your vagus nerve. So I'm going to do a couple of demos for you. So this is really easy, and there are a lot of exercises on the internet that you can do. So the first one, and it's very easy. So we're going to take our left hand and put it on your head. You're not going to pull the head. You're going to actually first you're going to tilt the head to the right. Okay, take your left hand and just place it on the top of your head. You're not pulling, you're just placing it there. And you're looking up. You're looking up. You're gazing to as far right as you can be. And you're usually either lying down or you're sitting in a chair like I am. And for 30 seconds, you just count to yourself. You maintain that gaze. You come out of it. Do the same thing with the other side. Again, your ear and your elbow on the line, okay? And you just put the hand here, gaze upward. 30 seconds. And you reset. Another thing you can do, I don't know if it's going to show here. I have to tilt my camera. There you go. Is you take it's the same thing. So let's say I'm going to do this. I'm going to, tilt my head to the right and gaze up. About to take this arm here and kind of bring it in. I'm not pressing it. I'm just holding it there with a little light pull, kind of like a yin and a yang. I'm pulling here, resting this one here. Again, the same thing. So when I do the first maneuver, it actually helps to relax the neck muscles, which get really, really tense in every day, especially if you do a lot of work with the computer. And the other one kind of helps relax the trunk muscles. So these are simple maneuvers. There's lots of other vagal exercises. So it's all about using the vagus nerve to your advantage, because that is really what brings in the parasympathetic nervous system. So we want to really expound on the vagal nerve and the parasympathetic nervous system and get out of that sympathetic overdrive that all of us are in. We're living in really stressful times. COVID, politics, Roe versus Wade, all the stuff that I mentioned 2 weeks ago, they're still here and they're not going away. There's one variant after another. I can't even keep it straight. So these exercises are important. This is kind of an experiential session. I want you to enjoy that. So with that in mind, I'd like to hear how some of you deal with this. And because this is really important stuff. Okay. Oh, good. I got a question already. Do you think your patients are more stressed now than in the past? Do you think technology has caused an increase in stress despite making our lives? There is no question in my mind. Yes. First of all, let me see if I get this. Great question, by the way. Technology is great, right? And I'm all for it. I really am. But we're so dependent on it. Like when something breaks down, like if our phones aren't working correctly, or fax not working, or emails, or the cyberspace is screwing up, it just gets us more and more riled up. And then the nerve system comes on, right? We're really tense. And so okay, this is out of our control. And believe me, if anyone's privy to this, it's me. I terribly frustrated when things aren't going my way. So technology is a double-edged sword. And I do think we are stressed more because I think, the country's more divided than ever before. I think recent Supreme Court decisions have added more stress to our lives in general. This whole thing with COVID ain't going away. I mean, there's just one variant after another. And I thought I was on top of it. I've been on top of this since it began. But now it's like, what are we doing? More people are coming down. Fortunately, they aren't as sick as they were before probably because of the vaccinations and that we are getting some type of a herd immunity. But it's a very stressful time. So, yeah, I think we are definitely in for a tough time. That's why these exercises are so important. We have to get out of the stress. We're like hamsters in a wheel. We need to do something about it. Then question. Okay, does EMF affect the autonomic nervous system? Oh, no question about it. We are all dealing with EMFs. I mean, theoretically, you shouldn't have your phone near your bed. You shouldn't have a TV in your bedroom. These are all, we should turn off. All your switches should be pulled from the wall units at night. I don't do all that. But theoretically, we should. We need to decrease our EMF exposure. And it's only increasing, right? Everybody's got cell phones. Everybody's going to Starbucks. Everybody's got high Wi-Fi. So it's not a good thing. And there are ways that you can actually test for the EMF in your surroundings. I haven't done it yet, but I may wish to do that soon. But there are a lot of devices that are just creating this whole EMF thing, and it adds insult to injury. It's definitely very stressful. So thank you. Okay, I do meditation and prayers for anxiety, especially when I can't sleep. I have issues with sleep and hormones. Well, thank you. Very good, Marta, because meditation and prayer is very important. And you don't have to be religious. I'm not religious. I'm spiritually based. So I do pray. But when I pray, it's kind of like a gratitude thing. I don't pray for, oh, please give me this or give me that. I mean, I don't want my prayer to be a demand. I want my prayer to be a prayer. And it's time for gratitude. And also I think about patients that are ill and people that I know that are struggling with disease, or whether it's mental or physical. So that's also very calming, very relaxing and giving, and it's parasympathetic. So it's great to do that before you go to bed at night. I always tell people, and I teach people how to breathe. That's one of my big things. I'm the cardiologist that teaches people how to breathe because it's so simple that no one does it. But I try to, when I get up in the morning, I sit up in bed and I put my back against the bedpost and I start my breathing. And I do it for try to do it for 20 minutes. And then I get out of bed, do a little Tai Chi movements. But I've been doing it for a while, so I can do it for 20 minutes. I tell people to start off with 10 breaths. I just taught my mother, who's 96 years old, last week how to deep breathe because she gets anxious. She has these spells in the morning after she awakens, in which we don't know if they're TIAs, we don't know what they are, but she gets very, very nervous, excited. She can't talk, she can't move, she got to sit down. And it bothers her because she otherwise is extremely together, and her cognitive function is amazing for anyone in that age group. So I've taught her how to breathe, and we did it together. And I think it's going to help if she maintains it. Okay, thanks for the nerve exercise. Thank you. I love giving you exercise because I think it's important. Okay, infrared saunas help with stress. Absolutely. Another great question. I'm a big fan of infrared. Has a lot of health benefits. We'll probably talk about that in a future session. Earthing or being grounded, very important. If you ever need any materials, you go to the Earthing Institute. I think it's earthinginstitute.net. Unfortunately, we lost one of our major pioneers in earthing, Dr. Stephen Sinatra, who passed away in just about not quite a month ago. And he got me interested in earthing and being grounded, and we did a study together on its effects on blood pressure. And so he was a big loss because he was really the one that introduced me to integrative cardiology. But grounding is important. It's anti-aging. It's relaxing. It's free. You're picking up electrons from the Earth's surface, and just walking on grass, walking on sand on a beach. It really does something. And it's also a natural blood thinner. It's amazing. So it's really important. Okay, let's see. These glasses aren't helping anymore. Okay. Massages, yeah. Massages are very good. Different types of massage, but whatever relaxes you. See, that's just it. There's no rule here. Whatever relaxes you is what you should do. I go to a rolfer, so this is like kind of a more of intense body work. Some people say it's like hitting your head on concrete. I don't know. I've been going to the same guy for many years, and because I've had nerve damage due to previous botched up back surgery, he really helps you with motion. The work that we do together, but it is relaxing to me, even though it's physically demanding, because I can let someone else is taking care of me, right? I'm not doing it on my own anymore. So, same thing with chiropractic adjustments. I'm a big fan. I go to chiropractor once a week just to maintain my my sense of well-being and my structure. Okay, let's see. So yeah, massages, chiropractic, infrared sauna, grounding, earthing, all these things are really important. How do you address? Oh, somebody was right. Okay, acupuncture help. Acupuncture is great. I have an acupuncturist that rents for me, rent space in my office. She's there on Tuesdays and Saturdays when I'm not here. Yeah, it's extremely relaxing. I fall asleep, but then again, I fall asleep almost anywhere doing any. And it's just amazing. But acupuncture is clearly very useful in stress reduction. So yes, and I would say that it's a good vagal maneuver. Can a straight neck cause yes, okay. Now I didn't go into this because we've done this before in some of my other talks, but arrhythmias. Arrhythmias is, I personally think, related to an imbalance of the autonomic nervous system. And it could be sympathetic overdrive. But I also want you to know that the vagus nerve, which is what we're talking about, we want to stimulate it. We want the vagus nerve to be our end all be all, but it also can give us trouble at times. There are some people that they can develop an arrhythmia called atrial fibrillation, which is extremely common, most common arrhythmia in those over age 70, but we see it in young people as well. And it can be inappropriately stimulated by stress, by trauma, by medication. And if it's overly stimulated, this is the calming nerve, right? You can go into AFib. And we see it with people that develop AFib at night, at rest, with dinner, drinking. So the vagal maneuver actually can be too much for these people. So again, we need to, it's the whole thing about finding that balance. Okay, yes, acupuncture is great. How do you help the vagus nerve? Well, it's doing these maneuvers. It's the whole thing. Actually, doing the vagal maneuvers I mentioned. There's others, and if you go to the internet, you'll find lots. I like these because they can be simple. Just remember it's not a pulling. It's a resting your head. You're just resting it on the top of your head, and then you're looking to the opposite direction. So I'm gazing upward, and if I want to extend and use this one, that's another maneuver. So I'm actually a little more effort, but I'm freeing up these. I'm also relaxing my muscles. So, and box breathing, deep breathing. All these things we're talking about will help your parasympathetic nervous system take over, and the vagal nerve. So it's really important. Um, so PVCs and PACs, I think, I deal a lot with one of the most common things that bring people into a cardiology office is palpitations. And I always have to ask people, what do you mean by palpitation? Is it beating too fast? Is it beating too slow? Is it skipping beats? What does it feel like? I've never experienced a palpitation, knock on wood. I don't know what it is. I've never had one. So, but I'm sure I have irregular beats. I just don't feel them. So I have to take in good history. And then I find out about what triggers the patient may have. Stress is usually number one. Drinking is a big one. We used to think about this French paradox that you've heard of in the past. Ain't no French paradox. That was not even well founded by science. The French brought that up in the 80s. And but we found out that really drinking is less salutary than we ever thought. And it can generally actually not just precipitate atrial fibrillation, but can cause atrial fibrillation. So arrhythmias are a whole different ballpark. And if you go back to my library, you will see that I've talked about atrial fibrillation and palpitations in the past. And we'll do it again. I like to always kind of rekindle these things. Great. So Alicia, I want to make sure I got everything here. Oh, good. Let's see. What's your favorite herbs to help with anxiety and stress? That's really funny that you asked that because one of the patients asked it today. One that I like is what do I like? You know those senior moments when you can't remember what you're trying to say? I'm having one of them. It'll come to me in a minute. Um, oh, give me a hint. I can't think right at the top of my head, but I just can't think right now. But it'll come to me in a second. There are herbs that can help with anxiety and stress. Um, like, okay, there's a few things like green tea can help. Um, what else? I just can't think top of my head right now. Thank you, ashwagandha. Thank you very much. Ashwagandha is a great herb. It's adaptogen. Okay, it can help to regulate your mood. So it keeps you centered. So ashwagandha is a great one. It's been around forever, Ayurvedic medicine, and there are other ones as well. But it's another one I can't think of. It's been used in stress. But I take supplements and so forth. I don't depend on that for my stress reduction. Maybe that's why I can't remember some of the names, but I will do more with the experiential stuff. I try to do the exercises and the vagal maneuvers that'll help stimulate the vagus nerve. Kava Kava was yes, Kava Kava, I recommended it like 20 years ago. But as it turns out, Kava Kava and also St. John's wort have too many interactions with other herbs and also with medications. So I tend not to suggest those anymore because of the drug interactions. Like even I think like St. John's wort, you can't really go out in the sun. It can make you very photosensitive. And Kava Kava also has some major disadvantages. But when it was the big talk of town like 20, 25 years ago, it was like the best thing to slice bread. Lavender. Thank you. Lavender is a great thing you can put under your pillow. I like using diffusers. We use it every now and then. Diffusers really help with sleep. Lavender is good. Lemon balm is very helpful as well. Now it's coming out. Ashwagandha. Is it too late to take valerian herb? No. Is it safe? Yeah, valerian root is very, very healthy. Like I have my own Sleepwise product for Heartwise, and it's got valerian root, passion flower, lemon balm, melatonin, which is not really an herb, and also something else. It's a fifth component. I think it's fetal blood. So these are all kind of natural sleep agents that can help. And it doesn't work for everybody, but it can help for a lot of people. And nothing's worse than sleepless nights. It's that problem I don't have. But a lot of people do. Insomnia is extremely common. I think it affects way over 20, 30% of the population at large. And even if just we aren't getting adequate sleep, and I think that alone, that also is a major source of stress. And because when you're sleeping, guess what? Your parasympathetic nervous system is working because your heart rate is lower, your blood pressure is lower, your respiratory rate is lower. And people say, well, what should I aim for with relaxation? Your respirations should be at rest. Get this, guys, like no more than 6 per minute. Because if you really work on these breathing exercises and do them on a regular basis, and when you're just lying in bed or sitting straight up, you'll see that you can easily do very well with just 6 breaths a minute. You don't need more. Conserve your energy when you need it, because when you need the fight or flight, you got it. That's going to be automatic. But we need to relax more. We need to do vagal maneuvers. We need to, steady the calm. Have you heard of pink noise? No, pink noise box for sleep. No, I have not. So, gosh, okay. So Eric just mentioned that. I'll have to look that one up. Pink nose box. Okay. No, I haven't heard of it. It's kind of a tongue twister. I will look it up. Honeywell makes it. Okay. Honeywell. Okay. Well, I will look that one up, guys. All right. So we got some great ideas here. You people are really good audience tonight. And that's the thing is that, it's limitless how many things you can do. But the thing is to just do it. I mean, if I can teach my 96-year-old mother how to breathe, that's a major accomplishment. Like I call her and like, Ma, did you breathe? Yeah, I did it. Okay. And I quit every morning because she said it's helping. She doesn't have as many spells. She gets really nervous. She can't think of the word. It's like she starts to her garbled speech. And and she gets very agitated because she knows it's not her. She knows what she wants to say, but she can't get the words out. It almost sounds like a mini stroke, but this almost habitual with her, and we think there's a high anxiety component to it. Anyway, so I'm all about being proactive when it comes to this, and stress is not going to go away. I don't think COVID is going away anytime soon. And I don't know about the political scene. It doesn't look real promising right now, but we can respond. The stress is there. It's how we respond to it. We have to just take a deep breath. We have to get in within ourselves, do the breathing, do these activities that we love. Singing is a great way. Chanting. I'd like to dance, Tai Chi, all these things. Doesn't matter what it is, but whatever brings you in the moment is going to help you stress and help balance this otherwise out of balance autonomic nervous system. So I think that's it. Thank you guys so much. In 2 weeks, I probably won't be doing a YouTube live because I'm very happy to announce that you'll be hearing about this. So Dr. Ben White, who's an esteemed functional medicine chiropractor, very dear friend of mine, and a couple other doctors, we're going to be doing kind of a tribute to Stephen Sinatra, who was my teacher and mentor. And it's going to be on YouTube Live, and we can figure out how to do it. So that'll probably be in 2 weeks. And so you guys will get announcements about that. But so then we'll resume in August with my individual session. So thank you guys. I'm very grateful that you spent the time here on a Thursday evening. Please check the thumbs up or like button if you see any of my videos, because it helps my ratings. And please get your friends to subscribe, because also with my book coming out in September, we want to have a full list of subscribers. So thank you so much, and enjoy the rest of this month. And I'll let you know about the function we have with Dr. Sinatra. We have a date picked out, but I don't want to quite mention it yet, but it'll be in 2 weeks. So just waiting to get the confirmation. Okay, good night. Thank you guys. And we'll see you in a few weeks. Thanks. Bye-bye.